Hello, my name is Taylor Williams, and I'm a biomedical engineer with a concentration in engineering management. Today I'm here to present to you wearable biosensors to monitor symptoms and detect necrotizing enterocolitis in NICU patients. On average, there are over 4 million babies born each year, with approximately 1 in 9 of these babies being born prematurely that will end up in the neonatal intensive care unit. Of these NICU admissions, approximately 1 to 5% of the patients will experience a gastrointestinal disease known as necrotizing enterocolitis. Gastrointestinal immaturity is a common occurrence with premature infants, which can lead to the development of necrotizing enterocolitis, also known as NEC. Necrotizing enterocolitis is a gastrointestinal disease that occurs when the wall of the intestine is invaded by bacteria, causing inflammation and necrosis of the tissue of the large and small intestine. This can ultimately lead to perforation of the intestine and spillage of stool into the abdomen, causing overwhelming infection, multi-organ failure, and even sometimes death. If caught early, necrotizing enterocolitis can be treated with antibiotics, but is often not and requires invasive and very expensive surgery. To diagnose this disease, doctors rely on an abnormal X-ray that demonstrates gas bubbles in the bowel in combination with bradycardia, unstable body temperature, bowel sounds detected via a stethoscope, and abdominal distension, or essentially a nurse's individual assessment. These current and selected diagnostic tools are discontinuous and nonspecific to necrotizing enterocolitis, so diagnosis is reliant on physicians recognizing symptoms, which often does not happen until onset is severe. My solution, which is a wearable biosensor system that integrates existing medical technologies, new electronics, and algorithms to detect necrotizing enterocolitis in neonatal intensive care unit patients, solves the problem of a lack of diagnostic tools ahead of time before it is too late for the premature infant. The underlying magic with this solution is it combines 4 symptoms of NEC that alone cannot predict the disease. It measures for them and combines them in an algorithm to aid as a predictor of the patient's level of probably having NEC. It does this using real-time data and key predictors of this high mortality disease. Electrocardiography, or ECG, will measure the heart rate and ECG trace, which can detect arrhythmias, or in this case, specifically bradycardia. A strain gauge will allow for the detection of abdominal distension in the patient by the stretching of the band that is worn around the patient's abdomen. A temperature sensor will detect unstable temperatures or major fluctuations between high and low temperatures. An acoustic sensor will measure bowel sounds or the absence thereof, which is a good indicator of onset of the disease. An integrated algorithm will allow the 4 contributing symptoms to be monitored, analyzed in conjunction, and converted to associated risk numbers to determine the current risk level for necrotizing enterocolitis, thus alerting the doctor if further checks should be made on the patient. The market for this device is hospitals, specifically those with NICUs. While there are many hospitals with premature infants, the addressable market size is around 12,000 patients a year, which will equal roughly 56,000 devices needed at full market reach. Roughly $5 billion a year is spent on NEC treatment and surgery, meaning there is great room for improvement with sales of the wearable predictive biosensor that is only $2,500 per unit. The current tools used for early diagnosis in the NICU can be unreliable and/or unspecific to gastrointestinal issues. Several times a day, nurses conduct a general assessment of the baby's health. This assessment includes measuring vitals by hand and completing a checklist of tasks. This information is discontinuous, and there is no standardized protocol currently for looking specifically for signs of NEC or general GI diseases. The HERO system captures heart rate variability and outputs the probability that the patient will become septic within the next 24 hours. This system has been proven to provide early indication of infection, but it can be difficult to narrow down the source specifically for NEC. Currently, X-ray is how diagnosis for NEC is confirmed. X-rays can catch NEC early, but involve dangerous amounts of radiation and cannot be prescribed for a patient without probable cause. The wearable sensor system will alert physicians to order an X-ray for diagnosis in early stages. There is great opportunity within this market for improvement for our device. The startup team for this device consists of 18 full-time employees, including a CEO, a chief financial officer, a chief marketing officer, a chief IT officer, and a chief technical officer in management, several sales individuals marketing the devices to hospitals with NICUs, operations and production people to assemble and engineer the devices, and IT support. Biomedical engineers will be developing and assembling the product, while they will be supported by management and sales individuals to get the product to patients as needed. Clinical consultants through hospitals will also be available as needed. This device will be able to effectively serve hospitals deploying a proper business model and marketing strategies. There will be an initial $2,050,000 capital investment from all the management team split evenly, and an initial loan of $1,750,000 to kickstart the company. The manufacturing facility will be operational from the beginning, and it is assumed that the FDA 510(k) is approved Q1 2020 before any manufacturing ever occurs on these devices. Utilizing its employees, equipment, facilities, and capital funding, the initial output of wearable sensor systems to hospitals will be 70 units, with a 5% monthly growth every month after that. The product will have a $1,000 manufacturing cost and a $2,500 unit price. The commercial organization will initially be 4 sales representatives that operate at salary plus 12.5% commission based on device sales, with this being expanded as the sales escalate and more representatives are needed. The commercial organization will drive device sales through a direct to hospital market channel, leveraging their hospital knowledge and extensive contact base for sales. The company expects to have a net loss in years 1 to 2 to help fund operating costs and necessary kickstart funding to be able to begin manufacturing wearable sensor systems for hospitals at a steady rate. However, the business plan also projects the device making a $14 million gross profit in year 5 and $67 million total sales by year 5. Additionally, there will be a $30 million 5-year gross profit cumulative. The device will have been designed and developed, pre-marketed, tested, and ready to launch prior to the FDA 510(k) approval in Q1 2020. The company expects to break even around year 3, achieve globalization years 10 and 11, and exit the market about years 13 and 14. The NEC diagnostic predictor can help to save hundreds of premature babies a year, so please help us do what it takes to get this wearable sensor system to the hospitals that need them for the premature babies. Thank you so much, and let me know if you have any questions.